Hi, I'm Jodi Mitchell, Director of Government Relations and Policy for the Center for Health Affairs and CHAMPS GPO. I'm bringing you this episode of Policy Points to focus on preserving Medicaid coverage for Ohioans. Medicaid provides high-quality care for more than 72 million Americans, including hardworking families, children, seniors, veterans, and people with disabilities. More specifically, Medicaid covers 41% of all births in the United States, nearly half of the children with special health care needs, 1 in 3 children with cancer, over 1.6 million veterans, and 62% of nursing home residents. In addition, many health systems and providers, including those in rural areas, rely on Medicaid funding to support access to essential medical services, mental health care, and other important programs. Significant cuts to Medicaid would stress the availability of healthcare services for everyone. Providers that serve disproportionately high rates of Medicaid routinely operate at a financial loss. Additional reductions in federal support for Medicaid would exacerbate these pressures and could strip essential healthcare services for entire communities. As Congress deliberates plans to reduce federal spending, including proposals to drastically cut funding for Medicaid, the Ohio General Assembly proposed budget includes trigger language that if the federal share of Medicaid funding is reduced below 90%, the state shall immediately discontinue all medical assistance for members of the Medicaid expansion group. In the latest sub-bill, we appreciate the Ohio House for addressing the need for a transition plan, recognizing the importance of healthcare coverage by prioritizing redirection of individuals to other options for coverage should theirs be eliminated. However, for this transition plan to work, the immediate and mandatory trigger language must be revised by changing shall to may to give the administration time to analyze available options and offer the greatest number of Ohioans access to health care. In addition, Ohio has sought a waiver to implement workforce requirements for the current Medicaid expansion population. These policy changes would drastically reduce access to health care for many Ohioans, most of whom are employed. The Ohio Department of Medicaid noted that impacted population includes nearly 800,000 individuals and that 73% are expected to maintain coverage due to work, exemptions, or other Medicaid eligibility. This leaves approximately 215,000 people who require further evaluation. Overall, Medicaid estimated that 62,000 Ohioans would lose eligibility over the next biennium. With 3 million Ohioans relying on the Medicaid program, potential funding cuts could send shockwaves through hospitals, communities, and the state's economy. Beyond the immediate rise in the uninsured population, leading to delayed care and poorer health outcomes, we would also see a significant financial impact. Estimates suggested uncompensated care costs could rise 25% to 30%, ultimately driving up healthcare costs overall. Cuts to Medicaid wouldn't just reduce access to care, they could financially cripple hospitals, forcing service reductions and closures. That impact would then ripple across communities, affecting jobs and economic stability. This isn't just about coverage for Medicaid beneficiaries. There are significant community and economic impacts, specifically in Northeast Ohio. We have to continue to collectively educate policymakers. The Center for Health Affairs recently joined the Ohio Medicaid Matters Coalition, urging the Ohio General Assembly and the DeWine administration to maintain flexibility and authority over Ohio Medicaid benefits as the federal government weighs cuts to the program. Acknowledging Medicaid as a critical driving force in fostering thriving communities, the Center for Health Affairs supports preserving Medicaid coverage for Ohioans.